Hi, my name is Talisa Ramirez. I'm doing the IV fluid and med administration video. I am in BSN 266. I have on my correct badge, scrubs, and watch, no jewelry, no nails. So first I have all my supplies. So I have the 15 of the tubing. I have my fluids here. I also have my math here. So for the fluid, it will be 38 drops per minute. I have all of my calculations here. And then for the meds, it would be 100 drops per minute. The meds that she's receiving is amoxicillin. I have already checked the provider's orders. I have also I've checked the provider's order. So first I'm going to knock on the door, provide patient privacy, perform hand hygiene. I'm going to apply my gloves. I have introduced myself. I have told my patient what is going on, what I'm doing. Prior to this, I have already checked the patient's allergies. My patient does not have any allergies. Okay, so to perform, first I'm going to show you my tubing here. Okay, so this here is the spike. This is the drip chamber. This is the clamp. If it's up all the way, that means it's open. So like that, it's open. And then you go all the way down, it's closed. Okay, you have your Y port here and your adapter. This connects to the patient. This Y port could be used for IV push medication, things like that. Okay, so that is the primary tubing. Let me show you the secondary tubing. This is similar to the primary tubing, just a little different. Okay, so this is the spike, drip chamber, the roller clamp, and then this is just the adapter that will connect to the Y port in the primary. Okay, so I want to get all of my supplies here. Okay, so for my fluids, I am going to get ready to spike my bag. Okay, so I am going to keep this covered because you don't want to uncover this to get any germs or anything. You want to take off the blue that was here, and I just pulled it off. Okay, now I'm going to take off my top. I'm going to insert it into my fluids here. Make sure you push, 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 because you don't want it to come out. You want to make sure your your roller's clamped, and you are going to turn your bag upside down. I'm going to hang my fluids here. Okay. So now, since I have my fluids hung here, you want it to be 30 inches above the patient. So what I'm going to do is prime my tubing. So I'm going to put air into the tube here. I'm just going to fill up the drip chamber here. Okay. I want to hold my tubing down. I'm going to let some of the fluid come through the tubing into my trash can here. You just want a couple of drops to come on out to get the air out. Okay. Now I'm going to count my drops. for 1 minute. And the fluid is supposed to be 38 drops per minute. Okay. So my patient is at, my fluids are at 38 drops per minute. Okay. So now I need to connect my piggyback to my patient. So what I'm going to do is I'm going to move my primary tubing here. Move my primary tubing here. Put that just right there to hold it. Okay. I'm gonna get out my medication. And I'm gonna get my tubing. And it is pretty much the same process. You want to make sure that your hemp is down. Okay, I'm going to remove the blue. I'm going to spike my bag all the way down. Twist, twist, twist. Okay. Now, I want to put my primary bag lower because I want to give my piggyback first, so I want to put that higher. I'm going to put my piggyback bag up here. And now this one needs to be 100 drops per minute. So I'm going to fill up my drip chamber here, just halfway. Okay, perfect. And now we're going to start. We're gonna let some of the prominent tubing, let some of that go. And what I'm doing right now is just getting the air out of the lung, just priming the tube. Couple drip drops. Okay. So what I'm going to do is I'm going to wipe my Y port on my original IV line. Clean with alcohol, let it dry. And then I want to connect my my secondary tubing, piggyback tubing to that line. And now I need to check this one. I need to count this one to 100 drops per minute. So I'm going to open this one here. And we're going to count 100 drops. this back down and attach my okay, so just to go over this again, my original fluids are 38 drops per minute, and my piggyback is 100 drops per minute. I have looked over these. I have counted for 1 minute to make sure that I verify this. This next piece I would connect to my patient. I would wipe my patient's IV tubing and connect this to my patient. Okay, I will take my gloves off, perform hand hygiene, and document.